Hello, I'm Sunny Zhou from Northeastern University in Boston. Today, I would like to share with you some of my thought on combining therapeutic agent with laser for the treatment of scar. First, some disclosure here. I'm a chemist who make drugs, so I have my own company and have been consulting with several other companies. I also want to thank Pete, Ray, and David for giving me feedback for my talk I'm presenting to you today. So, as you may know, there's a recent review in JAMA Dermatology on evidence-based clinical practice on laser-assisted drug delivery. And the highlight here are particular combination for a scar treatment. As you can see that the evidence and the strengths are not very strong. And for example, one of the drug tested is Verteporfin, is a calcium channel antagonist, and the proposed mechanism is to decrease extracellular matrix protein production, which as a hypothesis may lead to scar formation. As I'll elaborate a little bit later today, that these molecules only address one factor in scar formation and management. As we discussed later as well, other mechanism or maybe a combined mechanism treatment may be more effective. Again, here I'll thank Dave and Pete for be part of this study as well. So the molecule, the drug combination, laser combination mentioned in the previous slide are all small molecule drugs. So it's really very nice work shows on this slide, and serious work from the same lab shows that large molecule, for example, antibodies, can also be effectively delivered via ablative fractional laser. And so by passive diffusion. Shows on the top is the laser-assisted drug delivery. For example, after 4 hours, you can see the antibody penetrated certain depths. The bottom is a microinjection that can deliver more drugs and last perhaps longer. Also, once the drug are delivered to the site, they can diffuse away, and after 2 days, you can see these antibody drugs will diffuse away as well, which is not surprising once we deliver to the site. So given this type of work, other labs are encouraged to deliver large molecules such proteins for scar treatment and management. So this particular paper published 2-3 years ago is a combined laser-assisted delivery or intralesional injection of botulinum toxin, Botox, in the treatment of scar. And what they did is in one patient divide the scar to half. The T is topical, means on laser combined with topical application. IL is intralesion injection. So both shows improvement but the two types of a scar has a little bit different response. Shows over here is before the treatment, hypertrophic scar, and A is the control, and B is 6 months of the treatment, and the top one, the topical application, seems to have a better outcome. With other scar, I did show the slide a little bit different. So in any case, this shows that this combination therapy can be more effective than laser treatment alone in many cases. So the question is why this combination works. So this is something we don't know exactly how the mechanism yet. Botulinum toxin has been used for a long time for the prevention and treatment of a scar. You know, the original, more widely application is for cosmetic application, and the main mechanism is to paralyze a muscle by inactivate the neuron, at least temporarily for 3 months. A new formulation of botulinum toxin just being released last year can last for 6 months. So that's another new opportunity as well, depends on how long we want to last. But the mechanisms and the hypothesis for botulinum toxin in scar prevention and reduction is generally falls into 3 groups. The one is wound tension. So this is a mechanotransduction because the muscle are temporarily paralyzed and there's much less tension. And this will inhibit many of the chemical and biological pathway induced by the mechanotransduction pathway tension. The other one is botulinum toxin can reduce inflammation, and the reduced inflammation also will lead to reduce the collagen secretion, and this has been proposed to reduce scar formation. The other one is a general fibroblast pathways, and this is also more complicated, and so this can inhibit fibroblast pathways. Some of our mentioned below are proliferation of the fibroblast cells themselves. Also will stimulate the production of certain protein factors, basic fibroblast growth factors, which in turn decrease collagen production. And the toxin can also decrease release of TGF beta 1, which stimulates collagen production. So again, these are the working hypotheses in the field. So if these hypotheses are correct, and there are evidence suggests that botulinum toxin indeed affect these pathways, then perhaps what we can do is target these individual factors directly or in a combination fashion. So the several studies I mentioned before is the combination of laser and these therapeutic agents in human. So the next slide will talk a little bit about potential repurpose of some therapies has been tested in human already for scar prevention and management. So if you remember from the previous slide, botulinum toxin reduce and target a certain pathway highlighted here. And these pathways include TFG beta and some other pathway. And these are from a drug treat systemic sclerosis, is another fibrotic disease. The question is whether they do share underlying mechanism. If so, whether this drug, all 3 are antibody-based drug, has been developed for systemic sclerosis, SSC, whether it can be repurposed for scar treatment. Again, these drugs has been approved for human application, right? So that's an opportunity for repurpose. Another example I mentioned is this is a treatment alone has been shown some efficacy for scar reduction. To my knowledge, has not been combined with a laser treatment. So I just want to mention this treatment. So this treatment is based on inhibition of transglutaminase. This is an enzyme shows over here at the bottom. Transglutaminase couple 2 amino acid residue in peptide proteins. One is the glutamine residue, and the other one is a lysine residue from another protein. So this resulted in a protein cross-linking form called isopeptide bond. And these cross-linking are different than the typical collagen cross-linking. And this is catalyzed by several transglutaminase enzyme in human is most likely catalyzed by TG2. Is a transglutaminase, also depends on calcium. So this cross-linked protein has a different property than typical collagen cross-linking. So this shows over here that in the scar tissues, excessive cross-linking have been observed, and these this cross-linking also resistant to collagenase and matrix metalloproteins too. So they are different than the normal cross-linking observed for collagen in the normal skin. So this paper and other study has shown that there's transglutaminase, tissue transglutaminase has been elevated, overexpressed in the fibroblasts in the skin scar. Also, reduction of the enzyme activity do correlate to reduce the protein cross-linking by transglutaminase. So on the next slide shows some clinical data. So this work shows on this slide is by two Dr. Trendich and Dolly Chuck from Canada. So they ran a phase 3 trial with a relatively small group, but they did a control in a breast reduction patient, and then they do a control with the left and the right breast as a control, one with treatment, the other with sham. So what they did to reduce transglutaminase activity is using a diaminobutane. So essentially, this is a competitive substrate for the transglutaminase. As you may recall, transglutaminase, one of the substrate is a lysine residue from protein, is amine, and with this small molecule amine is effectively competing with that protein lysoamine, so it won't form cross-linking. And you can see that this is a treatment with this small molecule reduce the scar quite effectively. Again, this is a treatment has not been combined with a laser treatment for scar reduction. This is for scar prevention. But based on what we know about cross-linking involves transglutaminase, this may be an attractive opportunity to test further. So let's move on. I started with the treatment in human and combined with laser, then move into a human treatment therapeutic agency alone. And here is a more recent study published in Science 2021 from Gertner and Langerter's lab at Stanford. I think Dr. Gertner now moved to Arizona. And I want to emphasize this work was published in mice. Of course, we know there maybe the skin are quite different. I know there are current study on pig and human are going on and planning. But in any case, this paper highlight a very interesting and clear mechanistic-based potential treatment for scar. So what they're doing is look at this transduction pathway, force, tension, and wound, and it goes down to a molecular level of YAP interaction with its partner protein. And the YAP stands for yes-associated protein here. And it's known that a drug, Verteporfin, of which the structure is shown here, this molecule is sold under the name called Visudyne. As you may know, actually it's a photosensitizer to treat eye disease and has been contemplated to treat cancer as well. So it's a quite safe molecule. So it's known that this molecule, Verteporfin, can inhibit YAP interaction. So in this paper, that they did is shows that mechanical tension drive the Engrailed-1 activation pathway with the established mechanical conduction signaling. And specifically, Verteporfin is an inhibitor for YAP, and this will significantly reduce the scar formation. Moreover, not only reduce the scar formation, they also have recovered other skin appendage or structure like hair follicles and other things. So this is quite promising. Again, this is in mice. We'll have to see what will whether work out in human or not. But I think excited about this one is a mechanistic-based drug design program. And the drug itself has been used in human and is safe. The last slide about ideas is something we haven't mentioned during this talk. We talk about spatial delivery of drug, right? Local laser treatment allows a spatial delivery. And that's actually an advantage because some of the drug we can use relatively high concentration locally and deliver directly to the scar site. One thing we did not mention is the temporal, the time component of the drug, because some of the drug depends on the scar healing process should be activated at a certain time, not at the beginning. This can be done by repeated injection, but again, with a laser, you have to damage the skin again. So how do we deliver a drug, for example, distribution and go to the skin, and then only activate it at a certain time point, right, with a temporal control? And one possibility actually is use light. You not use the ablative light, just use a general light. And so this is basically calls into the photomedicine field, right, not a much milder light. So my lab invented a method that we can reversibly modify protein and peptides by enzymatic method, and then with the light we can release the active form of a protein peptide. In many ways similar to the small molecule prodrug approach, and shows here, illustrate here, we can have a protein no activity locked in the gel, and with light we can release it. So this allows both the spatial and the temporal control of this drug. My other interest in my lab is using stimuli or other stimuli other than light can trigger the release of drug. I'll be happy to share more details. So in the last 15 minutes, this is just summary what I shared with you today. So I start with light in human application combination with botulinum toxin, Botox, and other small molecule drugs. And then I moved to human therapy alone, which has not been combined with light, but shows some promise in scar reduction and treatment, such as the Transglutaminase inhibitor for crosslinking. Then I move on to some human potential can be repurposed drug target particular factor in the wound healing pathway. And finally, I mentioned a drug has been used in human but demonstrate efficacy in the mice study. I think this holds lots of promise in the treatment because I have a specific mechanism. And very last, I mentioned a new method that we can use a spatial temporal activation of protein drugs with light. And of course, with the better understanding of scar formation mechanism, such as mentioned here, as a drug maker, designer like me, we have much better way to test working hypotheses. Potentially, we can combine drug target different mechanism and have much better efficacy. My email is here. You're welcome to contact me. And thank you again for Pete for inviting me to be part of the program. And thank you for your attention.